Hello, I'm Sheila Blanco, Public Information Manager for Savannah-Chatham County Public Schools, and we're here today with a second part of our Medical Advisory Committee panel so that we can talk about some of the issues surrounding COVID and some of the questions some of our families have. You know, since this all began about 18 months or so ago, Dr. Levette and staff here at the school district have depended heavily on local doctors, local medical professionals to help us make decisions, to provide us with their best advice based on their areas of expertise, and that has allowed us to make decisions, what we felt were the best decisions for students as we moved through this pandemic, which of course has changed over time. The parameters of things have changed over time, and we started back to school this year 5 days a week in person. Most of our students are back 5 days a week in person if they wish to be, and there have been a lot of questions, and of course the situation is constantly changing. We are lucky today to be joined by four folks who have sat on our medical advisory panel, and I would like to introduce each of them. First, I want to introduce Dr. CAROLYN EILAND. She is a nurse practitioner with Curtis v. Cooper Primary Health Care, and I'm told she is a walking almanac of COVID-19 knowledge. That is what Mr. Grandy with Curtis v. Cooper tells us. Also, just next to her is Ms. Deja Fimphone. She is a licensed professional counselor and CEO at Introspection and Reflection, and she's going to talk a bit to us today about the social and emotional impacts on students and the community at large. Sitting next to her is Mr. Al Grandy. He is the CEO of Curtis v. Cooper Primary Health Care. And sitting next to him is Dr. DIANN BENNETT-MAGWOOD. She is a clinical doctor and also the healthcare science teacher at Woodville-Tompkins Technical and Career High School. Welcome to you all, and thank you so much for giving us your time today. We really appreciate it. I want to start out with a question that's obviously come up a lot in the news over the last week or so. You know, a lot of parents and their children have been eagerly awaiting news from vaccine manufacturers and the FDA on the progress towards authorizing vaccines for children ages 5 to 11. Pfizer, I believe, if I remember correctly, has just in the last week said that they have seen good results with their vaccine for children age 5 to 11. Not sure how long that process might take to be approved and actually start vaccinating students that age or children that age, because I know that they had to implement an emergency authorization for the initial vaccines before they were formally approved. So which of you can tackle this question about, you know, what your thoughts are on the safety of the vaccine for young children and how long this process might take to where we can actually start vaccinating some of our youngest people? Any of you like to tackle this?
I'll start. As far as the process goes, FDA and CDC is now looking at that clinical data to see, and we know that can take sometime a couple of months. The projected date is sometime December, early January. Safety, I feel that is safe for those children, even if it's approved on an emergency basis through FDA. It's no different than our other vaccines when we introduced them for the first time to our community. Efficacy, I'm confident in the efficacy as well as the safety.
Just as a follow-up to that, you know, a lot of people might think, well, if it was already deemed safe for adults, wouldn't you just give a lower dose? You know, kind of like when you're giving medication to a child, you give a lower dose of medication. Usually it's, you know, on the label what level of dose you give to a smaller person. Is that not the case? I mean, are there different types of health effects that a vaccine, that an immunization can have on a child that they had to do more than just reduce the dose?
Well, even in reducing the dose in normal medication, like your Tylenol, your Motrin, and any antibiotic, those reduced doses was in the clinical trial. Okay. So you look at those doses in that clinical trial to see what side effects or adverse effects it may cause to a child.
All right. Follow up on that, if when they reach a point where we assume that they will reach that children ages 5 to 11 can receive the Pfizer vaccine, what type of side effects should parents expect to see in their children? Because we all know a lot of adults, especially on the second shot, said they suffered some short-term, usually 24 hours or less, flu-like symptoms. Should they expect the same in children?
They should expect the same, and sometimes none. What we've noticed or what we've seen in our adults and in that population from 12 and up with Pfizer, some may had a sore arm at the vaccine site, flu-like symptoms, 24 hours, no longer than 24 hours.
All right.
Nothing to be alarmed about.
I want to address a question now about the social emotional aspects of what this past year and a half has meant to everybody. We all know as adults it's been rough on us to have to give up things, see everything get canceled, give up so many things that we are accustomed to enjoying. Students, though, lost so much. They lost essentially a year and a half of school. And they lost that socialization that is so important, especially at a young age, as young people are kind of discovering who they are and just moving forward, maturing in life. It's hard to do that when you're sitting home on a computer or sitting home without that interaction with your peers. Can you tell us, Ms. Pimphone, what types of repercussions people can expect to see socially and emotionally, and how people can help students as we returned to a more normal society?
That's right. We saw a significant increase in the number of children who were trying to cope with depression and anxiety. Children were extremely depressed. We had a lot more self-mutilating behaviors. Eating disorders were on the rise, suicidal thoughts, and it was simply because they were feeling the burdens of being away from their peers, decreased socialization, and also the things that were happening within the household. There were so many families impacted financially and economically as a result of the pandemic. So it was so much pressure. So right now we're dealing with the after effects of it, trying to help children to get back into this place where they're becoming more social. And we're still seeing some of the anxieties because they've been away for so long. So it's really difficult for children to get back into this place where they're feeling comfortable around their peers, especially the ones who are already grappling with self-esteem issues, depression, and social anxieties. It is even more overwhelming now. So we need to be very, very aware of what's happening with students, be able to identify those who could be struggling a lot more than it seems. A lot of times we'll see a decrease in their performance in school. We may see that they're even more withdrawn. They may not be interacting as much in class. And instead of saying, oh, this child is just in a weird space right now, or, oh, this child just doesn't want to talk, we need to look into it deeper and be able to address these issues therapeutically.
Follow-up question to that, a lot of people always think of kids especially as being very resilient. It's bad for them right now, but kids will adapt. Kids are more adaptable than adults because they're not as set in their ways. But if you see a student or you see your child is struggling, is there anything at home or anything that the community as a whole can do to help students reacclimate?
Absolutely, and you are right with how the expectation is for children to be resilient and to be adaptive. So you'll see the kids in school smiling, laughing, playing with peers, but on the inside, there's a lot of pain there. And we don't know how much trauma this child has experienced. It could be that they're working through their emotions of their parents being in the hospital. Perhaps a family member has passed away, but we just look at the outer and we're not really looking at the fact that this child could truly be traumatized. So it definitely needs to be addressed therapeutically. And we don't need to be afraid of asking a child, how are you feeling? You know, is there anything going on at home that you need to talk about? How has the pandemic affected you? And if we know that there has been a loss in the family, we really need to pull those children in, even if you do see them outside smiling and playing with peers. They work through their emotions differently than adults. We'll process things, we'll talk about it, we'll commiserate with others, but children just don't have the abilities to really work through their emotions the way that an adult does. So we have to tackle it aggressively and not just assume that the child is okay because they're smiling in school. We don't know. But we need to ask questions and have something set in place where there could be an assessment to determine if there's some traumatic grief or if they're just going through something that they could work through over the course of a few sessions. But they definitely need to be identified and they need to get the help that they deserve. It doesn't need to be overlooked.
Mr. Grandy, I want to ask you the next question I have. We're hitting that point where soon we got our first kind of little bit of cold snap this past week in Savannah. It felt great, but we're soon going to head into the colder months in the next 6 to 8 weeks. Last year, we all know that the holiday gatherings, the colder weather, people being inside. Created a rise in cases right after the holidays. Wanted to ask you about your thinking on those indoor activities and how they can be, perhaps you can help mitigate the spread of COVID-19 by frequent testing or a program of testing. I know you were talking to me before we began about athletes trying to mitigate the spread of COVID-19. Would that be through a testing program? Do you think that is one of the best ways to help do that?
Yes, I believe you have to have some form of mitigation. We had when it first started almost 18 months ago, we had testing anxiety. People didn't want to get tested. Then we had vaccine anxiety. Now, after these peaks of the holidays, the beginning of this year, we were seeing maybe testing 150 people a day. After 4th of July, we were testing 250 people a day. And the impact of have some scheduled testing, even in our own organization, where we had at least 20 people may have been positive during this period of time, we have ongoing testing. To make sure we do it like every 3 months or after a holiday, because what the impact is a synergistic impact. If one person is positive, then they're around a group, then those individuals have to be quarantined, then they have their family, then they create other issues around workforce, people being able home with their kids. So only thing with some form of mitigation of testing, where we do rapid and PCR, they should do with some schedule, then therefore that could, hopefully it could help mitigate some of this unnecessary spread or unknown spread of the virus if individuals are not vaccinated. Even if they are, it still could be positive, but the reaction for the individual is different, but it still could be spread and create other type of health problems for everyone in the community, especially an organization like ours. We're a healthcare facility, so if half our staff go down, we can't provide care. So that's why we look at it very seriously by doing the social distancing. We still do it in mask. We don't have a mask now because everyone is vaccinated here. We have some appropriate distancing as well. So just a safe practice, and especially when you have the holidays and individuals over, you don't know whether or not who they've been around. And that's where it gets a little bit more precarious in terms of individuals getting together, not knowing.
Well,
Mitigation, that would help.
do you think that program, a program of testing or a plan of testing, if you're going to be in a large group or you're involved in a group activity like athletics, is important even if everyone is vaccinated because of the breakthrough cases you hear about, because of the potential of you still have the ability to spread it even if you've been vaccinated and it's not making you sick? You could be asymptomatic and spreading it and not know.
The way that I look at it personally is may not be the individual, may not be me. It could be a family member. It could be a friend. We don't know who get in contact with whom. You know, you go to the grocery store, you know, people, different people. You don't know at that point. You become in contact with someone not knowing, not people purposely doing anything to spread, but doing some form of mitigation, which we would probably be doing very soon again, because we know it's coming up on the flu season, and after every holiday, we know it's a peak that we actually test everyone in our system of care to ensure that at least we have some form of mitigation. At least we know, an individual would know, then we can have a safe environment just to start off with.
All right. Dr. Bennett-MAGWOOD, I wanted to ask you a question about, you know, we're all expecting students to be able to get, younger students to be able to get the vaccine soon. Would it be important for them to get vaccinated even if they've already had COVID and they have antibodies present? You know, I'm not sure what the current practice is. If someone has had it and has some antibodies present, would it be important for them to go ahead and get vaccinated as soon as it's approved for younger students, or would they be advised to hold off a certain amount of time?
Well, not right away if they've had COVID, should they get vaccinated, but probably within 90 days or so, yes, they should get vaccinated, even if they've had COVID and have antibodies, because natural immunity has not been shown to be as effective as the vaccine as of right now. So I would definitely, I'm working at a high school, and everyone at the high school has the opportunity to be vaccinated, and a lot of them are not. So that is still an issue, and we're still facing a lot of the social emotional things that she was talking about as the after effects of the the pandemic, and how they've been virtual, and now they're kind of getting used to being back in school. And so I think the vaccination would be, I recommend that, yes, definitely.
Well, a follow-up question on that for you then, you know, a number of entities in our area, school district is, the city, Chatham Area Transportation, Chatham County, they're offering incentives to their employees to get vaccinated. Do you think, you said you still see a lot of folks not getting vaccinated, and I know you're talking some about students who are old enough, but do you think that will move the needle, that will help move the needle? And this question any of y'all can chime in on, but do you think that will help move the needle in getting more people in our community vaccinated?
I'm sorry, I didn't totally hear what you said.
The number of employers in the area are offering incentives. Do you think that incentives for folks to get vaccinated, do you think that is going to help move the needle and get more of those people who have been holding off on getting the vaccine? Do you think it's going to help?
Well, I believe it will be an incentive, but yeah, I think it will be helpful. The people that have been holding out for some reason, and sometimes an incentive will do it, and they'll do it for that reason. Yeah.
Is that what you're saying?
We actually did an incentive for the public for the week before 4th of July. So we gave $50 to anyone who got vaccinated. We put it on our reader board.
That's great.
It was a positive reaction. We were getting whole families in that we normally wouldn't get vaccinated. And people would come in. Also, we work with another program, and we were getting some gift cards. We get $20 for the public. And so that actually helped, because everything had went down after the J&J information came out. When it started to go up, we actually give our employees incentive. We had some individuals did not, but some got it because of the $200 that we gave as an incentive. Also, for some individuals that we have different periods that they can work on teams, that they get incentive to work on certain teams, so they got it, so they continue to work on the teams to get supplemental income. So they would do it because of that, for some financial reason, but they should do it for the medical reason. But the incentive, I would say about 25%, I guess, to say money talks, I guess, to some aspect. But more importantly, so it helps for those of the individuals who have some reason to not to get vaccinated for whatever the reasons may be. For, I guess, for me personally, I think is branding and how communication, how information that was actually communicated through our community and nationwide, because the individuals, no one, not to my knowledge, had an untoward event from getting the vaccine. We know people who have not gotten it had untoward events. But to answer your question, I believe that, yes, that the incentives does help. I think it probably would impact us, I would say, percentage-wise, maybe 25%.
We did. We went from like 74.36 to we're now at 91.56 or 66% of our employees being fully vaccinated.
Well, that's a question, and maybe maybe our licensed professional counselor here can weigh in on that. Is it sometimes it's not that people are anti-vaccine? Maybe they've just I'll get around to it, and it's not the top of their priority list, and they see an incentive like that. It's kind of like a sale right before the holidays, and you're just kind of holding out for you know that something better is going to come along, and all of a sudden you see 50% of okay, or I'm going to give you $200 or $50 or gift card to come get vaccinated. Do you think that really plays a role in something, even something as important as getting vaccinated, and people just holding out and going, well, I'll get around to it? They keep talking about offering incentives. How much of a difference do you think that makes to people?
I think it makes a really big difference. And some people are just like on the verge of taking it, but there's some fear there. And then when you offer an incentive, it gives them motivation, like, oh, okay. And for some people, it may be confirmation. Oh, there it is. I get this incentive. There's a reason for me to take the vaccine. But I certainly, from hearing from the doctors, it seems to have been effective for the people that have been offered the incentive. So for whatever reason, they're taking it. Thank goodness.
Dr. EILAND, I wanted to ask you about flu season. You said you'd like to talk about that because last year, everybody says flu season, which everybody, every year gets told, oh, go get your flu shot, go get your flu shot. Last year we had a really mild flu season, but everybody says, well, yeah, but that's because so many people were masked and staying away from other people, so it didn't have as great an opportunity to spread as normal. What do you think this flu season is going to be like, and will it be okay for people who have perhaps just had their COVID vaccine to also get a flu shot? I mean, is that putting too much stuff in your body at the same time, or will it be fine? Will they work together?
So let's address the first question first. What do I think this flu season will look like? Of course, the numbers are going to be greater than 165. It was 165 in the state of Georgia last year. We had 165 cases. Because we have laxed the masks, there are going to be an increase. So what we're encouraging, just like CDC, we're encouraging people to get their flu shots. But for those unvaxxers who are not vaccinated, it's more important for you to take the vaccine, and then you can get the flu shot 2 weeks later. You could get them 2 weeks apart.
2 weeks apart. Okay.
You can have them 2 weeks apart. So that's what we're pushing. Get your COVID vaccine and then get your flu shot. Because remember, the signs and the symptoms are the same. They're
Right.
almost the same. So when you come into the health center and you're sick, we're going to have to rule out COVID, we're going to have to rule out the flu, and we're going to have to rule out RSV, because we also have an increase of RSV in our community as well, which is, in an adult, it's just like a really, really bad cold.
Well, it's when COVID first really hit our community, when they shut down schools and everything. I know a number of people, including myself, commented, "Great, right in the middle of allergy season, where people are already wandering around sniffling, feeling a little under the weather because of allergies." And how do you tell which is which? So it's important to go ahead and get vaccinated for both, but 2 weeks apart.
But 2 weeks apart.
If I could, I'll explain to them the 3 different tests, what we do for mitigation from COVID to flu to RSV.
So we have rapid RSV tests that we're using on our pediatrics 18 and below, as well as the COVID rapid test, and the flu rapid test. So we're doing all three. And then if you think it's strep, we also do strep, but we've always done the strep.
And those are all rapid
They're
tests.
all
So,
rapid
so
tests.
they come in, they have symptoms, they don't know what the issue is, could be anything.
Right.
You can get a quick
So if
answer
COVID
for
is
them.
negative, then we're gonna do the RSV, RSV, and we're gonna do the flu as well.
Because many people said the reason why it wasn't any flu, because they diagnosed everyone with COVID. And, you know, that's a misconception. It depends upon where you went to get tested, but that was a misconception. Mostly because most people had masks, and they just did get flu, and people were separated. So for the
That's good
most
to know
period
that
of
there were separate tests for both. So you
Everyone
knew
had
for
masks
sure
on,
when you
too.
diagnosed somebody with COVID rather than the flu, you knew for sure it was COVID.
Sanitation was earmarked in most places. You know, a lot of cleaning and sanitation, doorknobs, everything. You know, a lot of restaurants, you know, where you know activity was lower than normal. So, you know, all of those factors why things were lower.
Okay. There has been a lot of talk about booster shots. They were just approved, I believe, Friday for certain segments of the population. So I guess a question, because you hear different things about different vaccines and which works better and which has some issues. Is it good? Should you or could you switch up vaccines? It may be if you had Moderna, get a booster that's COVID, and then that's Pfizer, or get a booster that's Johnson & Johnson, or should you stick with the same vaccine that you had?
So what CDC is saying for now, because they're looking at that data to see if you can switch it, they're asking you if you got Pfizer to get Pfizer. If you got Moderna, when Moderna is recommended, then get Moderna. J&J, the same thing. So we are doing it for the population that it has been approved for.
Okay, okay. So it's not, at this point, knowledge that switching it up and getting another will provide you some extra benefit that maybe the other vaccine provides. So that's good to know. Talking about breakthrough cases now, I want to ask you about those because, as we know, there have been breakthrough cases of people who have been vaccinated. And some of that has been caused, they think, by, I guess, asymptomatic spreaders, or it's causing people to be asymptomatic spreaders because you think, oh, I'm vaccinated. If I'm feeling under the weather, this can't possibly be COVID because I'm vaccinated. This must be allergies or the flu or something. But what are the chances, how high are the chances of getting a breakthrough case if you've been vaccinated? And how careful do you need to be? Because everybody wants to get out and live their lives again. How careful do you need to be if you've been vaccinated to avoid a breakthrough case? Anybody?
So let me answer that question. So what the data is showing is rather Pfizer or Moderna, if you was vaccinated early on, especially the seniors from 60 and above, we're seeing that the largest breakthrough cases is with the seniors. And of course, that's where we started, with the 65 and above. So you see that as being the largest breakthrough cases. So we're trying to get those people in to get those boosters because they're high risk. One, as we age, our immune system is not as strong as it was when we were in our 50s and in our 30s, and it's not able to fight, viruses and bacteria. So here you have an immune system that's not working as well, and then the vaccine is weaning. So those people need to do good hand washing, make sure they have on their mask, avoid large crowds if possible, and if they have to go in a large crowd, they need to have on their mask. But the first priority should be to see their PCP and get their booster.
All right. Talking about those large crowds, and this is going to be my final question, so I'd love everybody who feels that they have something to add to it or would like to say something to chime in on this. But the mayor has indicated that the city of Savannah will slowly begin to ease restrictions on some events as the community transmission index has started to decline. So I want to get all of your thoughts on this. Do you expect that declining trend to continue, or do you think relaxing those regulations or those restrictions on events might cause it to start trending up again. What are your opinions on that?
I think it's gonna decrease until we hit the holiday again. And then when we hit the holiday season, you have these large indoor gatherings. That's when the problem and the index is gonna go up again. That's the way I see it. Even when you look in retrospect, last year this time, it was going down, then all of a sudden, you got Thanksgiving, you had Christmas, New Year's, and then it went back up. January, February, we was at another peak.
So do you see this being an annual thing, kind of like the flu? Get your flu shot in the fall, get your COVID shot in the fall to
If we
boost
don't
your
get
immunity?
we don't reach a herd immunity and get these unvaccinated people vaccinated. And which I think once the vaccine is approved for that 5-year-old to 11, it's going to be very, very helpful with moving toward that herd immunity.
Anybody else want to chime in on that? Your thoughts on whether we're going to continue to trend down or if the relaxation of restrictions will possibly cause even a temporary rise? Yeah.
I think the people who were not wearing masks to begin with, they just chose not to, so it's not going to really make a difference. Even when there were mandates to wear them, they still didn't wear them. So I agree that we'll probably just be looking at an increase during the holidays because those who just refused regardless, and they would lose their jobs, they would not go places that mandated them as. So yeah, I think it's just a matter of us looking at the holidays and knowing that some of these cases will peak.
Well, that was all the questions I had for you all, unless there's something that we didn't talk about that any of you would like to address or think is important to put out there.
I'd just like to expound on that one question. I believe, too, that obviously having the relaxed restrictions is good because most of the people have some awareness. And if you look at the individuals that maybe the college age or people in college during that period of time, most of the colleges and universities, not all, require some form of testing. Some even require being vaccinated. So therefore, you have those large groups of individuals in those crowds, and some of the people that may be the actuary table a little older, they may have taken advantage of getting vaccinated, so they have the younger ones. So we have more individuals who may have practiced a little bit more safe in that environment. So hopefully it can keep the restrictions down because it create a synergistic effect, in terms of the overall economy, workforce, housing social determinants. It, overwhelms the health community. Just create situations that's unhealthy for everyone. So just me personally, I just hopefully it continues to go down.
And I would think going to your area of expertise, psychologically, there's only so long you can expect people not to go out and go to dinner or go to events or whatever it is. There's just maybe it's the American public. I don't know if it's worldwide, but certainly, you just hit a wall. And I think that a lot of people this past summer, vaccines had come out and people were starting to go out and live their best life again. And all of a sudden, the numbers started skyrocketing again in the summer with the Delta variant. And I think that really obviously was frustrating for a lot of people. And I think psychologically, we've talked about the impact on children, but I think for adults too, that was just very hard to see that and go, well, are we ever going to be done with this, Well, I thank you all for giving of your time today. I appreciate it. I think that this is all information that our families have asked us about. We've heard asked out in the community, and so I'm glad that you were all able to donate your time and your expertise and help to answer some of these questions that people have. Thank you so much for being here.
Thank
you.